So, what are our options for nipple reconstruction in patients that lose the nipple in breast cancer treatment? So, I'm just going to start out with my favorite option, which is 3D tattooing. I think 3D tattooing is the best possible option. It doesn't require an additional surgery with potential complications or problems. And most importantly, the area is totally flat. All of the options we have to reconstruct the nipple make a little nipple mound that's permanently erect, and it tends to be a little firmer than the natural nipple, which means it's more visible in clothing and drives patients nuts. So I love the 3D tattoo because they look incredible and they're flat. Now, for patients that it's important for them to have projection, it's meaningful, we can do probably the most popular thing is little flap procedures. Skate flap and CV flap are probably the most popular ones I see around in my area. But the gist of it is we make incisions where we have a little bit of tissue we raise up, little arms of tissue we raise up, and then we curve these little arms around this little thing on the top and create a nipple out of your own skin in the area. These are great little surgeries, but sometimes we have issues with the area shrinking. So we often overshoot and make it larger than we want, and it will shrink with time, but it can be unpredictable how much it shrinks, and you can get different shrinkage from side to side. Now, if you have irregularity of those little flaps, meaning that they're not the same or you're not getting enough projection, we can put something in them. So people have tried all different things. They've tried pieces of cartilage, they've tried little rolled up pieces of dermal matrix. I've seen people put filler in, fat grafting. There's a lot of different options to get more projection. Again, though, all of them are firmer than a natural nipple and tend to be kind of permanently erect, which makes them visible through clothing, and patients don't always love them. So I typically avoid that. Now, if you don't want to go through any of that fuss, they have these little silicone ones that you can stick on. You can even buy them online. They come in all different colors. You can be creative. So if you just want to wear one for an event or for some situation, you can get these little silicone ones that stick on. I find that patients really hate them. They don't stay on very well. The contour there is quite flat and it rubs on the bra. I've had people get irritation under them. They're just not super popular for everyday use. If you're someone who having an NAC is something that's meaningful to you after breast cancer surgery, I would recommend going the tattoo route and not wasting your time with those things. If you don't want to do any type of reconstruction, but you just want the option to throw something on in the right situation, then the silicone ones can be helpful.